Hello and welcome to this presentation. My name is Lauren Ingham and I am honored to be able to present to you today on Move to Live, which is a program targeting physical activity in adult populations in Reading, Pennsylvania. So let's get started. So first to start off with a quick program overview, and this is just a super concise sentence to help us know where we're headed. Move to Live is a community-based program seeking to improve activity levels in Reading, Pennsylvania's low-income adult population. And the premise behind this program is actually the Healthy People 2030 leading health indicator of increasing the proportion of adults who engage in enough aerobic and muscle strengthening activity. So our priority population in this is specifically low-income adults and even more so Hispanic and Latino communities within Reading, Pennsylvania. And this is backed up by that program rationale that I was talking about. So at a global level, one study found that after surveying 2.6 million global observational study participants, they found that less than 25% of all of those adults surveyed met physical activity guidelines globally. And the WHO goes further in stating that they estimate that 31% of adults do not meet physical activity recommendation levels. So this is a big deal globally. But when we get closer to home, in America, the American Heart Association, they say that 4 out of 5 American adults do not get enough regular exercise. And what are we talking about, that regular exercise? Well, federally in America, federal physical activity guidelines recommend 150 minutes of moderate or 75 minutes of vigorous aerobic activity and 2 days of muscle strengthening per week. So 4 out of every 5 adults, when we look at the entirety of America, are not meeting those requirements. And then when we get even closer to home, at least for me, in Pennsylvania, we've seen that 79% of Pennsylvanians don't meet these same recommended activity guidelines, which is a humongous population in America. This is concerning as obesity rates, which are highly related to diet and exercise habits, we've seen that in the literature, continue to show that 33% of Pennsylvanians are obese. And then even at a more local level, in Berks County, Pennsylvania, 24% of adults are not active outside of work. This is a statistic that reports participation in no physical activity, including doing any sports, or going on a walk, or cycling, playing with a pet, or going outside with a child. Reading, which is Berks County's largest city, makes up a large population of this county, and that shows us that this is something that has struggled within Reading populations as well. We also have seen through the literature that one of the key determinants of health that is associated with a lack in physical activity is actually low income level. And Reading has a poverty rate that is very high for the area, and over 75% of residents in Reading experience low to moderate income levels and a household income below 80% of the area median. So this shows us the why behind picking Reading as our priority population, specifically those adults. And when we get even more so into the why and looking at specifically why including Hispanic and Latino populations is important, that's because over 65% of Reading residents are Hispanic, and that's been seen as of a 2021 census. But it's a very big part of the population, and so because of that, it would be wrong to disclude them in the program goals. So going forward, after hearing the rationale and what our priority population is, it's time to focus on why we are doing what we are doing. And ultimately, at the end of the day, Move to Live's mission is we exist to build a healthier Reading by working with local partners to break down barriers limiting physical activity. So this is what's driving our goals, our objectives, our interventions that we're putting in on a daily basis. So what are our major goals based off that mission? Well, one, we want to increase access to physical activity opportunities to, at the end of the day, reduce preventable health conditions. And then also, two, we want to promote sustainable lifestyle patterns that will reduce inactivity. And again, going back to the why, we want to promote a healthier Reading, and this is one of the ways that we can work to do that. So some objectives supporting these goals, I have them broken into 2 different slides so we can look at goal 1 and then we can look at goal 2 as well. But objectives for goal 1, and also I will specify before we go into this that these are all broken out into more detail on the program planning paper that I have published. And in each of those objectives that you're going to see on these slides, These all have been formulated following the SMART format, which looks at specific, measurable, attainable, relevant, and time-sensitive matters to make sure that these are actually achievable in the long run. And then these also follow the hierarchy of objectives described in the textbook for this course, which is planning, implementing, and evaluating health promotion programs by Mackenzie, Niger, and Chakray. So when we go into these objectives, for goal 1, which is again to increase access to physical activity opportunities to reduce preventable health conditions, we are looking at 5 main objectives. And those are to implement 5 free monthly activity events, to increase community awareness, to encourage active lifestyles, partner with local officials, and secure community access to these programs that we're trying to operate. And then for our second goal, which again, we're looking at that overall promotion of health again, we are working to distribute promotional materials, create positive daily impacts in our participants' lives, to increase the number of weekly active days, which is more so just we want to be able to increase the number of days in a week that our participants are active, to partner with Tower Health, which is the local healthcare department and organization in the Reading area, and then to reduce county statistics of inactivity. To go back to those county statistics we saw in the program rationale of how many people in Berks County are not being active. We want to see those shifted a bit. So how are we actually going to make these objectives become a reality? Well, that comes through the interventions. So for the first goal, our goal and our plan then is to develop a monthly activity calendar, which is going to then provide those 5 free monthly events every month throughout the entire year. Launch a health communications campaign, which is going to bring awareness to what we are doing and the importance of it. Establish a community advisory board, which will help to be able to implement this in the long run. Advocate for environmental changes. As described in the paper that has already been submitted, there are many different areas in Reading that could use a lot of work on sidewalks and good lighting, safety, access to green spaces, etc. And then ultimately, at the end of the day, expand that monthly calendar with local partners. We know as Move to Live, as an organization, that although we are just wanting to begin this journey, we know that there is only so much that one organization can do, and we welcome collaboration with other local partners to be able to expand this in the long run. For goal 2, interventions include launching a 5-year communications campaign. This is kind of built off of one of the interventions for the first goal, which was just a health communications campaign in general. Doing this over a 5-year period will be able to allow us to get more access into communities, to reach a wider audience, and to make a greater impact. We also would like to incorporate health education workshops into our free activity events that we're running every month. This will be able to give people access to professionals in the field to gain little activity hacks, if you will, on how to implement more active living styles throughout their daily living. And then we would like to implement 5 free monthly activity events year-round. This has already been kind of talked about in some of the other interventions. By having 5 events each month, we'll be able to scatter that throughout the city. Reading is a bigger city. There's a lot of people who rely on public transportation or just on walking in order to get places. So if we can have 5 different events in different places in the city, there is a greater likelihood that people will be able to make it to one of them. And doing this year round also just helps with accessibility purposes. And then building a collaboration with Tower Health at the end of the day is going to be able to help us to increase our access in the community, to increase our reach, and also to utilize resources that we simply are too small to have. They have a public health department within the hospital. They have health educators. They have administrators that are already deeply invested into their community, and this proves as a very useful resource for development of both educational literature and just also getting useful practical insight into how best to operate in our community. And then furthermore, collaborate with local government and partners to expand impact. This has already kind of been mentioned on as well, but when we are able to collaborate with key stakeholders within the community, we're able to reach more people, and we are able to, at the end of the day, get to that healthier Reading status quicker and more effectively. So our goal is to be able to partner with local government at the commissioners level in the county, at the City of Reading government level, at different partnerships such as senior living, like Berks Encore is one of them in the community, partnering with YMCAs, with the Reading Public Library System, different community centers where we can expand our reach within the community. So, backing up this entire program is the health belief model. And this is a behavioral model which, at the end of the day, says that, and it hypothesizes that health behaviors depend on motivation, perceived threat, and perceived barriers. And both this model and logic modeling, which you'll see in a couple slides, those have been utilized in this planning process. And it is proposed that through utilizing community member input in the distribution of educational materials will help to increase the understanding of susceptibility to poor long-term health due to physical inactivity, and then through provision of free activity classes, events, mentorship, the workshops I was talking about, including more activity during daily living, perceived barriers will be able to decrease. So we're primarily focusing on the perceived threat and perceived barriers, those second points that you see there. But then motivation is also high. If you have more people in your local community who are invested in this, you're more likely to say, maybe I want to join as well. Resources required when we look at this program are vast, and they include multiple facets, including personnel, curricula, and instructional resources, equipment, supplies, and financial resources. As you can imagine, this list gets quite long, so I'll just highlight a few of them. Personnel-wise, our goal is to be able to implement a 5-member advisory board to be able to cover roles such as leading the board, outreach and events coordinators, public relations officer, social media and marketing coordinator, and treasurer secretary. Just the basics of what you need to be able to keep a team running and keep something organized. And then a team of 3 community volunteers to help with facilitating events, specifically because we're trying to target both the white and then Hispanic and Latino communities within Reading. Being able to have community members who are bilingual will be very, very beneficial in being able to reach more in the community and have a lasting impact. And then also contributors from the community who can contribute health and fitness expertise at times, really getting those subject matter experts involved in order to guide what we're doing, make sure we're doing best practice. Curricula and instructional materials that we're going to need include print materials on those activity hacks I was talking about from the workshops, pamphlets that hopefully we'll be able to partner with Tower Health to publish on the importance of physical activity, and then printable activity plans as needed for the local exercise events with examples of pictures or demonstrations of how to do the exercises that are displayed and demonstrated. Equipment and supplies is anything that you would think of, including even the picture you see on the screen right now. We would need pens, we need clipboards, we need a printer, paper to be able to print our pamphlets on, space for hosting, all of the things that you think of when you think of what you need to run an event. And then financial resources also are required. If we don't have the funding to do this, unfortunately, we can't buy the resources we need. You need money to be able to print things. You need money for sometimes even internet access, for getting supplies and refreshments, such as water bottles, for paying for gas expenses and reimbursements for subject matter experts that come in. So there's a lot of different small tasks and needs. A lot of those would be one-time purchases, but there are requirements that we must meet financially. So what does an implementation timeline look like? At a very, very large scale, our main steps are to 1, establish the board, 2, to fundraise a network, 3, develop a calendar, and then 4, launch a communications campaign. This is to get this off the ground. When we are establishing the board, being able to do that is going to allow us to communicate with local partners, which will allow us to fundraise and network, which will utilize the local partnerships that we've been able to make to then develop the calendar, which we will be able to do through discussing with the board, with our local partners, with host sites such as branches of the Reading Public Library, Berks Encore, etc. And then through making our calendar and having that all set and ready to go, we'll be able to launch a communications campaign advocating for accessible community engagement in these programs. If that looks very different depending on where we're at in the community. That could look like being able to expand our access so that we have flyers up in different clinics throughout the community, that we partner with local businesses and grocery stores so that they have advertisements up, that we are doing things on social media. It's a very vast marketing plan, and as I mentioned earlier with some other things, this is discussed in greater detail in the program planning paper. So when we look at the logic model of what we're expecting to have to input, what our outputs are going to be, and then what our outcomes are, this is the overall logic model. I know this is a lot of words to shove onto a screen. Do not feel like you need to read this all, but I just wanted to put it up there just to be able to show the logic and intention that is going into this plan. We know that there are many different moving parts that are required in order to make a program like this function. But at the end of the day, we are desiring outcomes that are going to have positive impacts on overall physical activity levels and health, that long-term partnerships within the community will be able to be established, and that even this could be included in school programming, in different county programs, and even expanded outside of the state long-term. Because overall, what we really want to see is a reduction in those county rates of adults who are participating in no physical activity outside of work. We overall, at the end of the day, through this program, long run, would like to see reduction in obesity rates. We know that that is a very wide-reaching goal, that is very far in the future, and we know that this one program is not going to be the only thing that helps to eliminate and to reduce those levels, but we do know that we can play a part, and that's what we're hoping to do through this program. So what's in it for the community? What's in it for people who participate? Well, at the very, very simple level, by participating in a community event like this, where it's a class setting, where you are participating with your neighbors, you get accountability in a community setting. And sometimes at the end of the day, that's what people need in order to make lasting changes. They need somebody who's going to be able to say, hey, are you coming to the event? I know there's one next week. And that keeps them accountable for their actions. That helps them to stay on track. Free and accessible resources is also a huge benefit to these community members. Like I said at the very beginning, we're trying to target the lower income bracket and communities within the city of Reading. We know poverty is a huge burden in this area, and we don't want to add to that burden. We want to alleviate it. So by adding resources that are free and accessible at accessible points in the community, at community centers that people know have a safe reputation, that they are welcome to come in at, that will be very beneficial even in the short term to people who are able to come and participate. Expert advice, like I've said, and recommendations coming from those subject matter experts who might be able to participate, even if it's just in program planning and getting feedback in the development of pamphlets. These are experts who have experience in the field, are knowledgeable in the subjects, and being able to get those recommendations and hear that advice in a comfortable setting that is accessible and free, and even oftentimes with the goal of being able to be implemented in a bilingual setting is a humongous perk of being able to join this program. And then, like I've said, but at the end of the day, the goal is to have long-term wellness and community improvement. And this looks very different for maybe even different neighborhoods within Reading. But at the end of the day, we know that being active more is going to prevent even non-communicable diseases, which at the end of the day can even promote lifespan and quality of life. So that's what we hope to be benefiting the community in the long term. So how can you get involved? As I think I said at the beginning of this presentation, we are just at the very, very beginning of trying to get this program off of the floor, get it up and running, get it moving. And so we need you to participate. We need your help to be able to make this happen. And there are two primary ways that you can do this as an organization or as an individual within the community. This can be as a donor or as a community sponsor. And as you see on the overview sheet that's been given to you today, we do have a budget of over $7,000 for a year, and that is primarily going to come in through both partnerships and donors. And so as a donor, you, yes, can give monetarily to our cause, and we will use that as best as we possibly can. We want to steward that wisely, but also donating resources such as, like I mentioned earlier, paper and activity mats for exercise classes. Donate your time to be able to help us organize, to give your expertise and your insight into developing programs and running them. And then as a community sponsor, you also could help us by providing publicity. If we were advertising and we gave you a pamphlet, putting that up in your business is super helpful for us to be able to spread the word. Host an event if you have the space for it at your organization, at your company, at one of your locations in the city, and it is safe and it's accessible to the community. We love to have you guest host us. You can help us by helping to develop resources. We've talked before about how it would be wonderful to partner with Tower Health and to get their insight and publishing resources. So if you have insight professionally into the development process of pamphlets and literature, especially with Spanish education and background, we would love your sponsorship in that. And then also volunteer at events. As a sponsor, we'd love to have you there. We also will be able to give publicity to your endeavors as you serve the community. And ultimately, we'd love to be able to work together to, at the end of the day, promote the health of Reading. So thank you for your time, for your consideration, and we look forward to partnering with you or your organization in the future to support a healthier Reading through Move to Lives programming. Thank you. On this slide, we have a list of references that were used in the making of this program.